students, my name is Swapnasi and today we are going to discuss about the liquid doses form. So liquid form of a dose of a drug used as a drug or medication intended for administration or consumption. So liquid form of a dose of that is used as a drug or medication intended for administration or consumption. There are potential advantages of oral liquid doses form. Okay, that means liquid doses form that are liquid preparation that are used as a drug or medication for internal use, sometimes external use. Okay, so there are potentially advantage of oral liquid doses form such as no dissolution time, rapid absorption from the stomach or intestine compared to tablet, which may be an important factor for pain relieving drugs. That means if we administer a tablet or some solid doses form, there is dissolution step, the absorption step, and then that particular tablet, that medicament reaches to the systemic circulation. But in a liquid doses form, there is an advantage or potential advantage such as there is no dissolution time, there is no rapid absorption, there is rapid absorption process from the stomach or intestine. Okay. So inherent in this benefit is the risk of reaching peak plasma levels too fast, which could be harmful. Finally, as the excipient technology advances, a controlled release profile in liquid forms will likely become readily available. Next, that is advantage of liquid dosage form. It has faster absorption as compared to solid, palatable, pleasant to taste, and best choice for children and old persons. Okay, next is classification. So liquid dosage form are classified into two categories. First one is monophasic and second one is biphasic. So first we go to the monophasic liquid dosage form. Monophasic liquid dosage form contains only one phase. The monophasic liquid dosage form further classified into different categories like liquids for internal use, that is drops, elixirs, linctors, syrups and draughts. And second is liquids for external use, liquid to be applied to the skin, that means liniments and lotion, and liquid meant for body cavity like gargles, throat paints, mouth washes, eye drops, eye lotions, ear drops and nasal drops, inhalations and sprays. Next is syrup. So syrup, it is saturated, syrups are saturated solutions of sucrose in purified water, sweet viscous preparation in which sugar concentration is about 66% weight by weight, and syrup containing medicinal substances are called medicated syrup, and those containing aromatic or flavored substance are known as flavored syrup. Okay, next is preparation of syrup. So for the syrup preparation, add sucrose to the purified water and heat it to the dissolved sucrose with occasional stirring. Cool it and add more of purified water to make the required weight. And syrup used in formulation of antibiotics, saline drugs, vitamins, antitussives and sedatives. So this is the method of preparation for syrup. First thing, we add sucrose in purified water and heat to dissolve sucrose with occasional stirring, and then cool it and add some purified water to make up the volume to make the required weight. And the syrup used in the formulation of antibiotics, so saline drugs, vitamins, sedatives and antitussive. Next is elixir. Elixirs are sweet, aromatic, colored preparation. They are hydroalcoholic preparation. The main ingredient of elixir are ethyl alcohol, or you can say ethanol, water, glycerine, propylene glycol, flavoring agent, syrup and preservative. So medicated elixir contain very potent drugs such as antibiotics, histamines, sedative, flavoring elixirs are used as flavors and vehicles. Next is linctus. So linctus, viscous liquid and oral preparation that are generally prescribed for the relief of cough. They contain medicament which have demulcent effect, sedative effect and expectorant action. Okay, demulcent effect, sedative effect and expectorant action. And linctus should be taken in a small dose, sipped and swallowed slowly without diluting it with water in order to have maximum and prolonged effect of medications. So simple syrup is used as vehicle for most of the linctuses. Next is tolu syrup is preferred in certain cases because of its aromatic odor and flavor. Linctus are viscous liquid preparation, oral preparation, and mostly prescribed for the relief of cough. Okay, and Linctus contains demulcent, sedative, and expectorant action, and based on this action, we use this category of medications or drugs for relief of cough. Next is drops. So liquid preparations meant for oral administration. The oil soluble vitamins such as vitamin A, vitamin D concentration in fish liver oil are present as drops for administration, and since these preparations contain potent medication, the dose must be measured accurately. Okay, next is liniments. So liniments are liquid preparation, or you can say it is semi-solid preparation meant for application to the skin. Liniment are usually applied to the skin with friction and rubbing of the skin. Liniment may be alcoholic or oily solution or emulsions also, and alcohol helps in penetration of medicament into the skin and also increase the counter irritant or rubefacient action. And arachis oil is used in some liniment which spread more easily on the skin. Soap is also included as ingredients in some of the liniment which helps in easy application of liniment on the skin. Liniment contain medicament possessing analgesics, rubefacient, soothing, counter-irritant or stimulating properties. And liniment should not be applied to broken skin. It may cause excess irritation. Liniments are liquid preparation meant for external use, or you can say the application to the skin. Liniment and second thing is lotion. They both are mostly same preparation. The difference on the liniment and lotion that are liniment contains alcohol and lotion do not contain alcohol. Okay, and whenever we apply liniments on the to the skin, so liniment usually applied to the skin with friction and the rubbing of skin. Okay, and we cannot apply the liniment on the ruptured skin or broken skin because the alcohol because liniment contains alcohol and it may cause irritation. So uh, liniments are usually applied to the skin with friction and rubbing of the skin. And next is lotions. So lotion preparation meant for external application without friction. They are applied directly to the skin with the help of some absorbent material like cotton, wool or gauze soaked in it, and lotion may be used for local action as cooling, soothing or protective purpose. So they are generally prescribed for antiseptic action, like examples of lotion, that is calamine lotion. The simple we can buy this from market easily. Next is the goggles. So goggles are aqueous solution used to prevent or treat the throat infection. They are usually available in a concentrated for with direction for dilution with warm water before use, and they are brought into contact with mucous membrane of the throat and are allowed to remain in contact with it for a few seconds. Next is next preparation, that is mouthwashes. So mouthwashes that are aqueous solution with a pleasant taste and odor used to make clean and deodorize the buccal cavity, and generally they contain antibacterial agent, alcohol, glycerin, sweetening agents, flavoring agents and coloring agents. Okay, that means the mouthwashes that are aqueous preparation or aqueous solution used to treat or used to clean or deodorize the buccal cavity or mouth. Okay, now throat paints. So throat paints are viscous liquid preparation used for mouth and throat infection. The main or the commonly used base in throat paint, preparation of throat paint, that is glycerin, which adhere to the mucous membrane for long time period and it possesses a sweet taste. Next is nasal drops. So nasal drops, solution of the drug that are instilled into the nose or nasal cavity with a dropper, and they are usually aqueous, not oily drops. So nasal drops should be isotonic, have neutral pH and viscosity similar to nasal secretion by using methyl alcohol. Okay, next is eardrops. So eardrop, as per its name, it is a sterile solution or suspension of drug that are instilled into ear or with a dropper. So the eardrop are usually made in aqueous vehicle. It should be sterile, isotonic with it should be sterile and isotonic and free from foreign particle to avoid the irritation. And eye lotion are aqueous solution used for washing the eyes, and they are supplied in concentrated form and are required to be diluted with warm water immediately before use. So it should be isotonic and free from a microorganism, free from foreign particle to avoid the irritation to the eyes. Next is biphasic liquid dosage form. So these all are the example or the preparation of monophasic liquid dosage form like syrup, elixir, linctus, drops, liniments, lotion, gargles, mouthwashes, throat paints, nasal drops, ear drops, and eye lotions. So next is biphasic liquid dosage form. As per its name, it contains two phases, and the examples of biphasic liquid dosage form are your suspension and emulsion. So these two preparation comes under the biphasic liquid dosage form. First one is suspension. So suspensions are biphasic liquid dosage form of medicament in which finally divided particles are dispersed in a liquid or semi-solid vehicle. The solid particle act as dispersed phase while liquid vehicle act as continuous phase. Okay, that means solid particles are completely dispersed in liquid media. Liquid media is known as continuous phase and solid particle act as dispersed phase. So suspensions are generally taken orally or by parenteral route. They are also used for external application, and many suspensions are supplied as dry powders which are converted into suspensions by adding the specified amount of vehicle before use. So this is done to ensure the stability of suspension. Example of suspension are ampicillin for oral suspension, barium sulfate suspension, insulin zinc suspension. Next is emulsion. So emulsion are same, these are biphasic liquid preparations containing two immiscible liquids, one of which is dispersed as minute globules into the other. So the liquid which is converted into minute globule is called the dispersed phase, and the liquid in which globules are dispersed is called the continuous phase. Same in dispersion, the liquid media, liquid vehicle act as continuous phase and solid particle act as dispersed phase. But in emulsion, the liquid which is converted into minute globule is called dispersed phase, and liquid in which the globules are dispersed is called continuous phase. So normally two immiscible liquids cannot be dispersed for a long time period, so we add emulsifying agent to the system to stabilize that emulsion, and it forms a film around the globule in order to scatter them indefinitely in the continuous phase, so that a stable emulsion is formed. And emulsions are two type. Actually, first one is single type of emulsion and second is multiple type of emulsion, mixed type of emulsion. Single type of emulsion contain two category: oil in water type, that means O by W type of emulsion, and W by O, that is water in oil type of emulsion. And mixed category, W by O by W and O by W by O emulsion are there. So first, that is oil in water type of emulsion, in which oil is in dispersed phase whereas water in continuous phase. So oil in water type of emulsion are preferred for internal use, and in these emulsions gum acacia, tragacanth, methyl cellulose, saponin, synthetic substances and soap form from monovalent bases like sodium, potassium, and used as an emulsifying agent. And in W by O type of emulsion, that means water in oil type of emulsion, water is in dispersed phase and oil is in continuous phase. So examples are wax, resin, beeswax, and soaps formed from divalent bases like calcium, magnesium, and zinc are used as emulsifying agent. and W by O type of emulsions are mainly used externally as lotions or cream. Next is IV emulsions, that means intravenous emulsions. The oil soluble hormones, vitamins like A, D and K are administered as IV injection. So the emulsified oils are also injected as a diagnostic aid, and these emulsions should have small globule particle size and must be sterile. And emulsions for external use may be both O by W or W by O type, but O by W type of emulsion is preferred for external use, and when a drug is emulsified, its rate of penetration through the skin may get reduced and it helps to prolong the action of a drug. Generally, the emulsions for application to the skin are semi-solid at room temperature and are considered to be an excellent vehicle. Advantages of liquid dosage form: the first advantage, that has fast absorption rate. Second, the patient who cannot swallow, so we can use liquid dosage form. It is more flexible in achieving the proper dosing. It is best choice for young children and elders. And the disadvantage, it has less accuracy, low stability, short shelf life due to low stability, and it is easily infected by microorganism and has special storage requirement and is easily infected by microorganism. So this is all about the liquid dosage form preparation. In next lecture we will discuss about the emulsion. So thank you everyone.